Hi, I'm Jean Schumacher, and I'm founder of Simply Plant Based, where I have a lot of programs to help you to change your health destiny. And today I have Dr. David Dunaief. He's an internist specializing in lifestyle medicine. His focus is on reversal, prevention, and treatment of chronic diseases through nutrition, fitness, and stress management. And he's going to practice on Long Island and Brooklyn. So thank you, Dr. Dunaief, for being here with me today.
Well, thank you, Jean, for inviting me. This is awesome to be here.
Well, you co-authored a paper in the American Journal of Lifestyle Medicine titled Rising Plasma Beta-Carotene is Associated with Diminishing C-Reactive Protein in Patients Consuming Dark Leafy Green Vegetables Rich in Low Inflammatory Foods Every Day, otherwise known as the Life Diet. Wow.
That's a long title. Yes,
That
it's
is
a
a
mouthful.
long title.
It is a mouthful. And that's why we're doing this video, so that I can explain to people what it all means.
Well, I just can't wait to dive into this because the title just like really intrigued me when you sent me the paper. I'm like, okay. So what made you decide to do this study in the first place?
Well, that's a great question. I've been in practice for about 10 years, and I've seen many patients, and I've noticed over the years that there was a trend that certain foods seemed to reduce inflammation while increasing the nutrient level or the beta-carotene, while other foods did not. And chronic inflammation is a central tenet to chronic disease. Patients also said they felt better when the inflammation went down. So the symptoms seemed to go away and the disease seemed to reverse itself.
Nice. Well, so let's start with some of the basics. What is chronic inflammation?
Chronic inflammation is best defined by looking at both acute and chronic inflammation. So acute inflammation is when you have a trauma or an infection, you get sick, all of a sudden the inflammation goes up. And that's acute inflammation, and then it goes down once you get better. Chronic inflammation, on the other hand, is smoldering inflammation that's long-term. So that means that you can't feel the inflammation necessarily until it becomes a chronic disease with symptoms, such as an autoimmune disease like rheumatoid arthritis, where you feel it in the joints, or also a heart attack, say, where you have the acute event of a heart attack, but you've had cardiovascular disease for a long time. So you don't know you have coronary artery disease, and all of a sudden it culminates in a heart attack, and that's the acute, but you've had the coronary artery disease for a long time, and the inflammation is smoldering, and you can't feel it until that event.
Well, I hate to ask the obvious, but why is this an issue?
Well, that's a great question. It contributes to the dysfunction of the endothelium, which is the inner lining of the blood vessel. And why is that so important? Is that blood basically feeds the tissue, the organs, the bones, everything that we have is fed by the blood and the nutrients in the blood. So if you can increase the nutrients in the blood by increasing, say, the beta-carotene, but beta-carotene is only a marker, but if you can increase the nutrients in the blood, you can help potentially treat and reverse the disease and also prevent disease. It's an issue because it can lead to cardiovascular events, as we mentioned, the heart attack, the stroke, the death, and it can contribute to other chronic diseases such as diabetes. Maybe you've heard of it.
Yeah.
Insulin resistance, chronic kidney disease, Alzheimer's, macular degeneration, rheumatoid arthritis, lupus, many forms of cancer. It can contribute to 80+% of chronic diseases.
The Alzheimer's is one that really is, for me, a big one because, you know, I just saw my mother-in-law go downhill because of Alzheimer's, and I think we have an epidemic coming of that. I mean, on one end of the spectrum, we've got people with Alzheimer's that don't know who they are and can't function in society, and at the other end, we've got people, you know, with autism. You know, one out of 68.
If I can go on with that, if I can take the ball and run with that for a minute, there were trials that have been looking at the beta amyloid plaques for Alzheimer's using drugs. But beta amyloid plaques are only signs of Alzheimer's. And I've been saying this for a long time. And finally, basically, that pipeline with all different drugs has dried up and shown that there's no effect on Alzheimer's with drugs so far. And that's very sad. And I wish there were drugs that would help, but right now there really aren't any significant drugs to help. However, at the same time, there's a study that just came in that showed that fruits and vegetables, eating lots of fruits and vegetables, eating a whole food plant-based diet focused on fruits and vegetables, you see Alzheimer's risk decrease by 46%. So this
my
is
gosh.
huge, right? This is huge. Even though you have no study right now that shows the treatment of Alzheimer's, there probably will be able to show a study for the treatment of Alzheimer's. But right now, at least we have a study with prevention that reduces it by almost half with diet.
That's crazy.
Isn't that crazy?
That
So
is.
as sad as it is that we don't have drugs to treat it, it's much better that we now have at least something to prevent it.
I know. Lifestyle. Anyway.
Lifestyle, exactly.
I know. We do have an epidemic coming, and I think this is one of the reasons why we're doing these videos, is to help get this information out there.
We're on the precipice of being able to treat, prevent, and reverse disease, and we should use it, and that comes from the lifestyle.
Absolutely. So how do we measure chronic inflammation in the body?
We measure chronic inflammation by using C-reactive protein, which is a biomarker that's in the body that has no specific inflammation. So it doesn't target one area. You can't say one area, oh, I have this disease, but it gives you a sense of you have inflammation in the body, which is so important. And it gives you that sense of that smoldering inflammation that we don't know we have, but we can only find it on the labs until we have a systemic event where we have some kind of symptoms that show up.
Okay. Well, what is C-reactive protein, and what prompted you to study this?
That's a great question. As I mentioned, it's an inflammatory factor that's produced by the liver and the inner lining of the blood vessels called the endothelium. And again, the endothelium is so important because the endothelium is involved with 230 miles of blood vessels, and blood vessels basically provide the nutrients to the rest of the body. So if that's in dysfunction or in disarray and has inflammation, we've got a real problem. And it's one of the most well-studied inflammatory factors. It allows us to look at non-specific, as I mentioned, systemic inflammation or throughout the body. It's associated with plaques in your arteries, hardening and narrowing of the blood vessels, but it's also associated with many, many different chronic diseases. And Dr. Paul Ritger at Harvard had studied CRP, C-reactive protein. We'll call it CRP for now on because it's easier to say. But he studied CRP and he used high sensitivity CRP to look at the smoldering levels of inflammation, and why high sensitivity CRP, it allows us to look more sensitive. It's more sensitive than just using CRP by itself. So you want to use high sensitivity CRP because it allows you to look at inflammation even to lower and lower levels. And even when it's at lower levels, if it's not low enough, it still can cause problems. So if the levels are above 3, which is not very high, it's still a problem. When it's below 2, it's even better. When it's below 1, it's optimal. So we want to work to get that inflammation lower. And
Right.
HSCRP, or high sensitivity CRP, lets us look at it. Whereas CRP by itself, basically less than 10 is where you're looking, not less than 3, 2, 1, or even undetectable levels of less than 0.1. Where I've had patients now, I've had dozens of patients who have gotten not just to the optimal levels of inflammation, but to undetectable levels of inflammation. That's like saying if you have HIV and you have an undetectable viral load, people do really well and they can't transmit the virus. Well, what do you think happens if people have undetectable inflammation, or at least this inflammatory factor that's undetectable?
Right.
Your risk of chronic disease goes way down, especially heart disease.
Well, I'm just going to share a quick one with you, because I remember when I first started this journey long ago in a land far, far away, and I asked my doctor, I said, I want to get a base blood level, and she said, okay, fine. And I want to measure my C-reactive protein. And then I want to do this again in 6 months, and I want to specifically measure the C-reactive protein. And she's like, why? I said, because I want to see it change. And she's like, it won't change. That pretty much stays. And I'm like, okay, but I want to measure it anyway. So
that's a really great point, because in medicine, in conventional medicine, we only have very few tools or very few drugs that actually reduce C-reactive protein. So most people think you can't change your inflammation.
I
And
know.
that's not the case. And
It's
you
the
can change
food.
the inflammation. It's the food.
It's the
Absolutely. It's
food.
the food that can change the inflammation. Absolutely.
Well, what are the pitfalls of taking a statin or any other medication for that matter?
Well, the statins, the great thing about statins is that they do reduce the inflammation. And Dr. Paul Ritker showed in his studies that you can reduce CRP or C-reactive protein to less than 2. And when you get it less than 2, the patient does better and better. The lower you get it, the better the patient does. And so you can reduce the risk of heart attack. And you can use statins such as Crestor, or you can use any other statin, but you can also use an interleukin 1B, but there aren't that many medications that reduce C-reactive protein. So monoclonal antibodies, like immunosuppressives, used in autoimmune disease actually may not reduce inflammation. They don't work necessarily by reducing inflammation. So some drugs do, very few drugs actually reduce CRP. And that's why doctors don't think necessarily that you can reduce some of your CRP. And that's why some of the doctors do. They don't know that a few medications do necessarily. But when they do, the medications, the pitfalls of them, well, one of the obvious ones is that all medications have side effects. When a new medication comes out and people say it doesn't have side effects, that's because it hasn't been long enough necessarily. But the side effect with Crestor or any other statin, and Crestor's chemical name is rosuvastatin. I'm just using the word Crestor because most people know that. And the side effect of Crestor can be muscle pain, really bad muscle pain called myalgias. But it also can increase diabetes. It can increase the risk of diabetes, but it also can increase the sugars of patients who are already diabetic. So it contributes to diabetes and exacerbating it, but it also can contribute to muscle pain and make people feel kind of lousy. And at the same time, it lowers the CRP, but you don't feel a change in your symptoms.
Right.
So you don't know that the CRP is going down. Whereas when you change it with lifestyle, the lifestyle not only reduces the inflammation, but reverses the disease. So your symptoms start to go away and may be eliminated completely. And you may be able to get off your medications. You may. It depends on how you're doing. Some medications may not, but other medications you may be able to get off. And some people can get off all medications, but they have to do really well on the lifestyle.
Okay. Well, that was my next question is what if I don't want to take medication? I mean, what else can I do to reduce my lower my CRP levels?
That is a really good question. Lifestyle changes with diet and exercise are huge, but especially the diet. And in this study, we used the low inflammatory foods every day, or what we call the Life diet, to treat patients, which is a nutrient-dense, whole food, plant-based diet. And this has a big impact on reducing CRP.
Wow. Well, you talked about how CRP reduction has been associated with the increased dietary intake of beta-carotene. Okay, what is beta-carotene?
Well, beta-carotene, to understand it, just think about vitamin A. It's a derivation of vitamin A. And then when it gets broken down, it breaks down into retinol. So it's basically it's a vitamin A derivation. And it's a phytonutrient. Phytonutrient means it's a plant-based nutrient. And there are 10,000 different phytonutrients. So phytonutrients are so important because they give benefit to the body. This is where you get the nutrients, where the nutrients go into the blood. And phytonutrients come mainly from fruits and vegetables. And phytonutrients have a family called carotenoids, and there are 600 carotenoids. And beta-carotene is one of them. And these carotenoids have antioxidant properties that lead to anti-inflammatory effect, thus reducing C-reactive protein and other inflammatory factors. And mainstream labs only use beta-carotene. They don't use the other phytonutrients. So we're using beta-carotene as a blood marker. We're not using beta-carotene specifically saying beta-carotene is the sole phytonutrient. It could be any of the 10,000. In fact, it could be all of the 10,000 that are working together. We don't know, but we're using beta-carotene as a marker. And like I mentioned, it's found in fruits and vegetables. It's also found in root vegetables, such as sweet potatoes and carrots. But when you cook a root vegetable, what I found in my practice is that it raises the beta-carotene, but it doesn't reduce the C-reactive protein. It actually doesn't reduce the inflammation. Right, that was really an amazing find. And that what you want to do is focus on dark green leafy vegetables, and that lowers the CRP, but not the sweet potato and not the cooked carrots. Raw carrots are great, but not the cooked carrots. Once you take a root vegetable and you cook it, it becomes a starchy vegetable. And starchy vegetable raises your sugar. So you want to try to avoid beta-carotene containing starchy vegetables, because then when you look at the blood for beta-carotene and you have a starchy vegetable that has beta-carotene, it's going to mask the actual results, so you can't tell whether the beta-carotene is raised because of dark leafy greens that lower CRP, or it's just raised because you've been eating starchy vegetables that have beta-carotene, like a sweet potato or a winter squash. And also, you're looking again at the blood levels of beta-carotene in the body representing the phytonutrients. We used it as an objective way to find out how much dark leafy green vegetables patients were eating after confirming with them that they were not eating lots of cooked carrots and cooked sweet potato. You probably could have sweet potato that was raw, and I've had pumpkin that was raw shaved on my salad, and that wouldn't have the same effect. Once you cook a root vegetable, it becomes a starchy vegetable that then raises your sugars potentially, and also doesn't lower the C-reactive protein or the inflammation, which is the goal, to lower the inflammation.
Right. Well, okay, I'm just throwing this out there. What if I don't like the dark leafy green vegetables? Can I just take a supplement of the beta-carotene? Would that work?
Well, that's a great question, because people have. And no, it doesn't work, because beta-carotene is just one phytonutrient. And as I mentioned, there are 10,000 phytonutrients, and we don't know how they work. We don't know, they work in a synergistic way, but we don't know exactly what works with what. So we can't just isolate it with a reductionist theory of medication and say, okay, we're going to take a beta-carotene supplement. And in fact, if you take a beta-carotene supplement, studies have shown when they did this with people who had lung cancer or smokers to prevent lung cancer, it actually increased the risk of lung cancer, not decreased the risk of lung cancer. And
Really?
it even happened, yes, and it even happened in previous smokers. So even if you stop smoking, you still can't take a beta-carotene supplement. And taking beta-carotene supplements doesn't bring down the inflammation. It just masks the level of beta-carotene. Another part is that not just supplements, but I qualify powders, vegetable powders, green vegetable powders, like supplements, because that's sort of what they are. And they have quote unquote phytonutrients, but those phytonutrients, once you dry a vegetable into a powder, are basically dead. And when I say dead, they raise the beta-carotene levels, but they don't reduce the inflammation. They don't help. So let me give you an example. I had a patient who I couldn't include in this study, but she had masked results. She started with the green powder before I saw her. Her beta-carotene levels were through the roof. Her husband said, you won't be able to treat her. She's eating really well. There won't be anything you can do. She had Crohn's disease. Her C-reactive protein was 6.4. Remember, high is above 3. So 6.4 is considerably higher than it should be.
Yeah.
She was on Remicade. It was an IV infusion of Remicade every 2 months. And again, her husband said she was eating incredibly well. And her beta-carotene was above normal levels. So you'd say, okay, there's nothing I can do because the beta-carotene is above levels. But it turned out she's using green powders. So we took away the green powders and we gave her dark leafy green vegetables. And in 4 months, her CRP went down to 0.6. And she was able to get off the Remicade that she had been on for 15 years. And her antibodies to Remicade stayed low. So if she had to go back, she could go back. Yeah. So she's still off the medication, and she's been off the medication now for about 2 years and hasn't had to go back.
Powerful.
And now she's undetectable. She's not only got low inflammation, but she's got undetectable inflammation according to what the lab can measure. So you want to stay away from the powders, and beta-carotene alone is only suggestive of C-reactive protein reduction if you're using dark leafy greens. But if you're using it to mask with starchy vegetables that have beta-carotene, or you're using green powders, they're not going to work.
Okay. No supplements, no powders. Got it. When you did this.
And also be careful of the starchy vegetables with the beta-carotene.
So when you did this study, what was the criteria for the people in this study?
That's a good question. The criteria was that the C-reactive protein, or the inflammation, the CRP, had to be equal to or greater than 2. Why 2? Well, we wanted to get results, but also Dr. Paul Ritger used 2 as the cutoff for his studies. So we followed that because those were randomized controlled studies that were published in the New England Journal of Medicine, and those were large studies. So we thought that would be a good number to get to show that we could reduce inflammation, but also this was a good cutoff. And we wanted to have the baseline beta-carotene, that nutrient level I was talking about, that phytonutrient, within the normal limits, because we wanted to be able to show what happens when beta-carotene goes above the normal limits. So that was very important. We wanted to avoid patients who had acute infections or traumas, because that raises the C-reactive protein, or the inflammation, and that's not smoldering chronic inflammation, that's acute inflammation. So you want that smoldering chronic inflammation. We again said that they shouldn't have the powders and the supplements. I think we did a slam dunk on that question prior. And we said that they shouldn't have more than 1 medium sweet potato in a week, or any starchy vegetable that has beta-carotene like the winter squashes, because that will throw off the numbers and show that the beta-carotene is falsely elevated to reduce the C-reactive protein. It's basically masking the results. So you don't want that beta-carotene to rise with the wrong foods, or I shouldn't say wrong foods, but the foods that raise the beta-carotene but have no effect on the inflammation. I'm not saying that starchy vegetables are necessarily bad for everybody, and I'm not saying they can't have them. Many people can, but in this study, if you did it, it would raise the beta-carotene to block.
Right.
And for some people, it doesn't raise the beta-carotene high enough because you're not eating a lot of
so that's your control.
Vegetables. Right, and so that's your control of not, well, you want to take out that, right, so you want to, that's our control with no starchy vegetables that raise beta-carotene. Patients were classified as adherent if they followed the Life diet. And the data was collected over time from the first visit through up to a year. And you weren't allowed to use statins, or if you were on statins, you weren't allowed to increase the dose of the statins or increase any drug that could potentially have an effect on C-reactive protein, either raising it or lowering it. So statins may be one of them, interleukin 1B may be one of them, and also prednisone may also reduce inflammation. So you didn't want to use drugs that could potentially have an effect on inflammation or confounding factor, so that you didn't know whether it was the drug or the diet.
Okay. Well, how many people were in the study, and what kind of people were in this study? I mean, does it apply to a very specific population or population at large? What are we talking?
So the type of people there were 43 people in this study, 22 who were adherent and 21 who are non-adherent. So 22 who followed the diet and 21 who didn't. And,
so we have our control and variable.
Right, we have our control and we have our experimental arm. And so what's also important is the diversity of the population. So there was another study done with fruits and vegetables that showed that with increased beta-carotene, you could reduce C-reactive protein, but it was only for 4 weeks, and it was in white men. And so we had a very small portion of the population over a very short period of time. And it's great that it showed it, it's wonderful. But our population had 65% women, and women tend to have a higher CRP, believe it or not, than men. And there were 26 non-white participants, African Americans or Black population, not just African Americans, because some people were from West Indies, and I don't want to say they were African Americans, but the Black population made up about 23.3%, and one patient was Hispanic. The age range was 28 to 88. So basically this covers a huge swath of population.
Yeah, you got a
And
large demographics there.
right, you got a large demographic, so you can't say, okay, this works in women who are pregnant and standing on one
Right.
foot sipping water through their left nostril. You can say this
What?
applies to many different people. You see, you get down to these specifics. It's like a
Yes.
baseball statistic where he hits a home run when the sun's out in the middle of the night on the left field wall when someone's hanging over the right field wall and getting in trouble. But you see what I mean by that?
Yes.
It applies to a whole swath of population. And the average fat percent was 37.8. What does this mean? I use a
Obese.
body impedance scale. So that means you're obese based on the fat. We're not looking at the BMI, we're looking at the fat. And the higher the fat, the more inflammation you have. So again, that can raise the CRP. So these are all makes it harder to bring down that CRP with diet. So what could we do? And people had a multitude of chronic diseases. They had diabetes, they had high blood pressure, they had high cholesterol, they had autoimmune diseases like ulcerative colitis and Crohn's and rheumatoid arthritis. So this was a huge swath of people. So it wasn't just, again, this one specific narrow area that we're extrapolating out and saying, okay, well, maybe if it works for women who are between the ages of 20 and 21, we can stretch it out to men who are between the ages of 80 and 81. No, we're covering basically the large demographic that is America.
Wow. Well, that's good. I mean, that you have a wide variety there. I mean, that's a huge demographic. Well, okay, what is the LIFE diet?
So the LIFE diet, again, stands for Low Inflammatory Foods Everyday Diet. It's an acronym. And it includes a smoothie, a 32-ounce smoothie with fruits and dark leafy green vegetables that I got to tell you, almost everybody loves. I think maybe one person doesn't love it or two people, but those are the people who don't blend it correctly. Then when they blend it correctly, everybody loves it. So not 100% love it, 150% love it, because their family members then start doing it and they're not the patients. But yes, people love this. And I got to tell you a very short story that my 9 and 11-year-old niece and nephew at the time hated vegetables. They totally hated vegetables. And I was making a smoothie. And they saw that it looked like chocolate because I put cocoa powder, unsweetened cocoa powder in it. And they said, is it chocolate? And I said, well, it has it in it. And they said, well, can we try it? And I said, sure. So I made the smoothie for them. And 2 minutes later, I crossed my fingers hoping they would be acceptable to them. And 2 minutes later, they said, could we have one? And I was like, oh my God, I'm blown over. They don't realize that there was so much in terms of dark leafy greens. And they said to me, this is great. So that's the moral of the story, that if they like it, anybody can like it.
Mikey likes it.
Mikey likes it, right. Remember that LIFE cereal. Right. This is the LIFE diet. So that's funny. You should choose that. It also was unlimited consumption of cruciferous vegetables and other dark leafy greens. And cruciferous vegetables are the broccoli cauliflower family, and they include kale, collards, baby bok choy, cabbage, Brussels sprouts, arugula, Swiss chard, mustard greens, not asparagus, broccolini, broccoli rabe, radishes, watercress. But there are other dark leafy greens like spinach and Swiss chard and romaine, but not romaine that's romaine hearts, but romaine that you get from a farmer's market, or the romaine you get in the supermarket that's on the shelf rather than in the package. So it's not whitish, it's green. And that's what makes it dark.
Did you have to cook these, or could they be eaten raw, or both?
That's a great question. They could be eaten raw and they could be eaten cooked. Either way, it didn't matter. And you could use frozen, you could use fresh. It didn't matter. And we encouraged patients to have other non-starchy vegetables like onions, mushrooms, garlic, zucchini, eggplant, tomatoes. Those are all wonderful. So we don't want to avoid those. And then they could have unlimited consumption of fruit. And we wanted them to specifically focus on berries because berries have the most power, but it didn't really matter. And then
that's my new crack. Berries.
Yeah, me too. Me
too.
My God. I mean, it's one of my favorite things. And when it's really ripe, it tastes better than anything.
Oh my God.
Right.
Yeah.
Right.
Yeah.
And then we encourage them to have at least a half cup of beans and legumes. And we limited the consumption of whole grains and starchy vegetables to no more than 2 servings a day. And then again, no more than 1 serving of carotenoid or beta-carotene containing starchy vegetables like the sweet potato or the acorn squash or butternut squash or pumpkin or something like that. And then no more than 1 serving of refined grains in a week. Basically, we really didn't want them to have a lot of refined grains.
Yeah.
But if they had refined grains, we wanted to limit it to once a week if possible. No more than 24 grams of sugar per day, and that's the stringent limit made by the American Heart Association, not the one that's made by the FDA where it says 50 grams of sugar. Why go higher? Why not go with the most stringent? You could have 1 to 2 ounces of raw seeds and nuts, and you didn't want them to have salt on it because salt's addictive too. It changes your taste buds and ruins the vegetables. And
it also stimulates your appetite.
Right.
It makes you eat more.
Right. It's addictive. That's what I mean by addictive. But thank you for explaining that. That's exactly what I meant to say. And you clarified that extremely well. And congratulations. That's wonderful. Thank you for helping.
I scored one.
What's that?
I'm scored one.
You scored one. Give her a dunk.
Okay.
There was a dust.
All right.
Yeah.
I'm keeping track.
Right. That's great. And then you also want to limit consumption of animal protein to a maximum of 4 ounces per day. But we discouraged animal protein, and if you're going to have it, we wanted it no more than 4 ounces a day, and we really wanted it every other day. And if you could eliminate that, that would be the ultimate. But we didn't push people because we didn't want to make them feel uncomfortable. You can still have a whole food, plant-based, nutrient-dense diet without taking away animal protein. Do you do better when you do it and you take away animal protein? Of course, but you don't want to be intimidated by saying, okay, you're excluding this. However, when it came to processed meats like bacon and dairy like butter and cheese, we said no more than once a month because that's a real issue. And we limited consumption of oils to 1 tablespoon per day, and we limited dates to 2 dates per day.
Just curious, why limit 2 medium dates per day?
Well, dates are delicious. We all know that, especially medjool dates. However, dates are still a dried fruit and they raise your sugars. So you do not want to have more than 2 dates at one time. And that's basically half a serving. And they're wonderful. They're wonderful. But again, especially with people who have diabetes or risk of diabetes, they can make your sugars go really high.
So what were the results of the study?
So that's a really good question. And if the results weren't good, we wouldn't be talking about it now.
Right.
So I have to just let that out. But what it showed was that the higher the beta-carotene blood levels with dark leafy greens, the inverse relationship with C-reactive protein or the inflammatory factor.
So what does an inverse relationship mean for those people who don't know what that means?
An inverse relationship means as the beta-carotene levels in the blood go up, that nutrient level goes up, the inflammation goes down, or inverse relationship. So it decreases as the nutrient levels go up. So you want to see that. So in other words, and that's a great question you ask, because what happens in the people who are adherent, and many of them doubled the beta-carotene level or the nutrient level from 48 to 100. And so they got above the normal level. And this was wonderful. And in return, the inflammation went down. So the inflammation went down significantly, or what we call highly statistically significant. It wasn't just statistically significant, it was highly statistically significant, which has to do with the p-value, not just less than 0.5, but less than 0.0001. So this was really impressive. And the CRP went down by 66% at the same time as the inflammation, at the same time the nutrient level doubled. And so it went from a CRP of 7.0 for the people who went above the beta-carotene levels of normal to 1.75. And half of those people who had 1.75 were in the optimal or undetectable levels.
Wow.
So this is really encouraging. So with the Life diet, you get additional benefits other than lowering CRP. You get the symptoms to go away. It's plausible that decreased CRP levels could be attributed to decrease in weight and fat, but as opposed to the anti-inflammatory effects. but that's unlikely because the inverse association with the beta-carotene and the CRP remained significant after the data were corrected for possible confounding factors such as weight. And this is really exciting because it means that the beta-carotene that rose from foods, and it had nothing to really do with weight or any other factors that we controlled for, and that when you get the CRP down, you get other benefits with the raising of the beta-carotene, such as symptomatology goes away and you get disease reversal or disease prevention. And that's huge. You don't see disease reversal very often in conventional medicine. It happens with Hep C, and it happens with a couple of other things like macular degeneration when you inject it in the eye. When you get an injection in the eye, like Lucentis, you get reversal and you're able to see, but you have to keep getting injections in order to see that reversal. So that's very interesting, but it's not, you have to get it every 1 to 2 months, and it's not reversal in the disease in the sense that you can stop taking those injections. So there are meds that reverse disease, but very few, and this helps you overall health. So if you have 5 different diseases, you know, the average number of chronic diseases is around 5 or 6 chronic diseases in patients who are 65 and older. So when you use lifestyle medicine with the Life diet, you get a reduction in not just one disease, but in all the diseases, and you start feeling better. So in other words, when I was doing this, when I started with changing my lifestyle to a whole food, plant-based, nutrient-dense diet, I noticed that my eczema went away. I had peeling 2 weeks every season, and it would be really painful and really embarrassing. So I'd hide my hands, and when people asked me if they could shake it, I would give it to them, but I'd pull it back as soon as they shook it because I was wincing in pain. And now I don't even use Lubriderm or any other kind of lubrication on my hands during the winter or any other time. And it's wonderful. I feel like I've been freed up, but I didn't even know that was a problem. I didn't even realize that I had eczema that could go away. And so there are other symptoms, like I had upset stomach, and that had to do with eating dairy for me, but that had to do with eating high-fat foods, not just dairy, like even coconut milk that was full fat that would cause problems for me, or mayonnaise that doesn't have dairy in it, that was high fat. I would find that I would have all these problems, and I'd be having upset stomachs and be in the bathroom for 2 hours at a time, 3 times a week. And I thought, wow, that's normal. That must be normal. And it turns out that's not normal. No. And in fact, what happened was it went away as soon as I started doing this. So I haven't had an upset stomach, knock on wood, in 14 years since I've been doing this diet. So the little things that you don't realize, even the fatigue goes away, and you may not know why the fatigue is there. You get more energy. So these things, the symptoms that may not even be related to a specific disease, start to go away. So this is huge, and medications just don't do that. And at the same time, it helps hydrate you. And hydration is such an important point. And if I can just take a second to mention that with hydration, you avoid problems like lightheadedness and nausea and vomiting, and it makes you, and you get so much more energy. And so being hydrated is so important. And the best hydrators are not water. Water is okay, but the problem is we're not made of water. So if we use fruits and vegetables.
What do you mean we're not made of water?
We're not made of water. We're made of fluids. We're made of electrolytes. We're made of all different things. So if we use fruits and vegetables and we use a smoothie, it absorbs much better, and your hydration goes up that much quicker, and you feel that much better, and you get that much more energy. So higher fruits and vegetables are associated with lower inflammation, such as the CRP.
Wow. That is amazing.
And that's what I said. I said, wow. I was wow the whole time.
Well, pat yourself on the back for that study. That was pretty amazing. Pretty darn amazing.
Well, thank you. Thank you. And it was great because I was seeing these trends in my practice anyway and hoping that it was going to come out in a study, but I kept seeing it over and over and over again, but you don't know until you put it to the test. Right. As Dr. Michael Greger would say, let's put it to the test. And we just did.
Wow. Well, are you planning any future studies?
We are planning to do a prospective clinical trial and to see if the life diet will slow or reverse disease in a clinical trial. And we're actually planning 1 or 2 of them.
What diseases are you focusing on?
Well, what we're going to focus on first is that we're going to focus on uveitis, which is inflammation in the eye. And we're going to see how it does. And we're also going to focus on wet macular degeneration, which is something that blocks people's central vision. And the reason we're doing this is that I'm working with the University of Pennsylvania, and my brother is an ophthalmologist who does research on macular degeneration. So he's providing the lab, he's providing the ability to use the patients, and he's providing other colleagues who have patients who are willing to do this, and he's providing a medical student who will help me run this, and he's providing the biostatistician that we will run the data. But I'm providing the diet, and I'm overseeing everything that goes on. So this is a really wonderful situation. And my brother, who works on macular degeneration and the effects of iron in macular degeneration, I had to explain to him, he's an integrative ophthalmologist because iron is basically a nutrient, and it's a micronutrient. And micronutrients break down into another category called the phytonutrients, as we explained, which there are 10,000 of them, and then break down into the carotenoids and other categories as well. So he's an integrative ophthalmologist, and when he saw these results, he was amazed. And when he felt better, he was amazed. He didn't think it would do anything for him, and all of a sudden, he feels great. And it's done wonderful things for his wife, and it's done wonderful things for my wife, Laura. And so I am so thankful that I'm doing this, because this has not only benefited my patients, but it's benefited me. It's benefited my family. It's benefited so many people that it's an organic process. That doesn't mean you have to eat all organic foods. This is an organic process, but it's benefited all of us. And that is an incredible journey that I hope to continue and to grow and to show people just how powerful lifestyle changes can be with the whole foods plant-based diet, and specifically the life diet, which is low inflammatory foods everyday diet.
Right. Wow. Well done to you, Doc. All right. Well, I'm looking forward to your next study. So.
Me too. Me too. I'm so excited to have other studies in the works, and I have other chart review retrospective studies that I'm working on as well. So this is very exciting, and I have so much data to go through to see other trends and everything else, and it'll never get boring. No. And it'll always get stronger and stronger. And we hope as time goes on, this grows to get more and more population of patients and more and more population of doctors who are convinced that this works.
It's true.
And more people in politics will change the standards of what we think of nutrition.
Like our friend, Eric Adams.
Right. Like our friend, Eric Adams, who's working very hard and diligently, but we need more politicians to do that. And Eric Adams is the leader, is the root or the organic process of this, because he saw change where his diabetes was so out of control, and he was going where he had blurry vision and he had numbness and tingling in his feet, and his A1C, his 3-month sugar, was about 17, and normal is less than 6, really less than 5.7, and he was able to get this under control as my patient, and he was able to bring it. And his mom was able to get off insulin. Two different types of insulin.
And she was diabetic for over 30 years.
And she was diabetic for many, many years.
Yeah.
And this is wonderful. And this shows you the power of how wonderful this stuff can be. And so we want to get this in schools. We want to get this to politicians. We want to get this to other doctors. We want to get this to more patients. We want to spread the word so it becomes so infectious that it's not a virus that spreads, but health that spreads.
Right. Well, that's one of the reasons why, and I've got a program coming up with Dr. Deborah Shapiro. We're launching the Pregnancy Advantage, and we're helping women to get their bodies pregnant ready. So before you even think about getting pregnant, that we're going to clean your body out, get all the toxins out, and get you ready so that when you do conceive, that you're going to bring into the world the healthiest possible baby.
And you know, the funny thing about that is I've always thought about that in the fact that you can change what's going on with epigenetics. With the milieu of the environment. And so you want the healthiest environment before you get pregnant. Because once you get pregnant, it's good to have a healthy environment, but you want it before, even before that first trimester, which is the most sensitive and critical, right? But even the third trimester is important. But you want to be healthy all the way through, and you want to continue that way, not only for you, but for when you give birth. And then when you give birth, you don't stop doing it, because if you're breastfeeding, you want to make that milk as healthy as possible. And again, you continue on and on and on. And so that you don't bring up kids that have predisposition to potentially chronic diseases like heart disease or asthma.
Well, I see it in the classroom. I've been in the classroom for 35 years, and I've been looking, all along, I've been like, why? What is going on with the kids? Because like our environment, I really didn't see it changing that much, because I was still, in my career. I mean, I've evolved, obviously to whole food plant-based, but I see the kids with ADD, ADHD, depression, anxiety. I mean, they're so stressed, they can't handle it, and they're just so overwhelmed, and it's the food.
It's the food that plays a huge role. It's the food. I mean, it was kind of like, to give the example, there was a cartoon a while back where there was a woman standing under power lines complaining that power lines were going to affect her fetus. And so the power lines were going to affect it, and she was complaining that there's a problem. And this was actually a real story in a cartoon form, but she had a cigarette in her mouth. So the lifestyle could have been, what can you control? And she could have controlled, obviously, the cigarette in her mouth before worrying about the outside environment. Control the inside environment before you worry about the outside environment. The outside environment is very, very important, and it brings up a really good point. When you do a plant-based diet, whether it's whole foods or it's not whole foods, it helps the environment. The footprint from using a plant-based diet is so much better on the planet. You use so much less water. Deforestation occurs so much less. We would be able to basically, if everybody went plant-based, there was just an article that said we could basically repopulate Africa with trees so that it was no longer had any desert, no longer had any problems with that, and we could repopulate that whole continent by just us in the United States going plant-based. Now, there's some good plant-based and some bad plant-based for your health, but in terms of the environment, outside environment, it doesn't matter which one you do. But for the inside environment of your health and potentially the fetus and potentially your family around you, you're going to help them a lot more if you do that whole food plant-based diet that's nutrient dense. And specifically, I have this Life diet, that low inflammatory foods everyday diet that uses, and what's the difference? It uses basically much more of emulsified foods or smoothies.
Wow. Well, thank you, Dr. Dunaief. Well done to you. Kudos to your study. And I look forward to the next one.
Well, thank you so much for having me. This has been wonderful. And I really enjoy it.
We'll see you on the next one.
Thank you.